What if I told you that up to 80% of chronic wounds don't heal? Not because of infection, because something you can't even see. It's called a biofilm, and if you're dealing with a wound that just won't close, this might be the reason why. Hi, I'm Melissa, a nurse who specializes in wound care. And today I'm going to break down what biofilms are, how to recognize them, and most importantly, what you can actually do at home to help disrupt them and support healing. Because once you understand biofilms, everything about wound care starts to make more sense. So, what is a biofilm? A biofilm is basically a protective shield made of bacteria. Instead of floating around individually, bacteria group together and produce this sticky, slimy layer that anchors them to the wound, protects them from antibiotics, and shields them from your immune system. Think of it like a fortress. Once it's built, it becomes extremely difficult to break through. And here's the critical piece. Studies show that up to 80% of chronic wounds contain biofilm. That means if a wound has been there for weeks or months, there's a really high chance that biofilm is part of the problem. Now let's talk about how to recognize a biofilm. You can't see biofilm directly, but your wound gives you clues. Here's what to look for. The wound stalled, no progress despite proper care. It may look clean one day and then develop a thin, slimy, shiny layer within 24 hours. Increased exudate or drainage without obvious infection, persistent inflammation or redness, and repeat cycles of it's getting better and then worse again. One of the biggest signs is that you clean the wound, it looks better, and then quickly goes right back to how it was. That's classic biofilm behavior. Now, here's why biofilm stops healing. Biofilm doesn't just sit there, it actively blocks healing. It does this by keeping the wound stuck in the inflammatory phase, preventing new tissue from forming, and reducing the effectiveness of topical treatments. So, even if you're doing everything right, if biofilm is present, healing can stall the wound completely. That's why disrupting biofilm is one of the most important steps in chronic wound care. Now let's talk about what you can do at home. One option I often recommend is Vashe wound solution. Vashe is a hypochlorous acid solution, which means it works in a way that helps disrupt biofilm structure, reduce bacterial load, and support a healthier wound environment. And the key here is how you use it. To remove a biofilm, you must use Vashe as a compress. Soak clean gauze with Vashe, apply it directly to the wound, leave it in place for about 2 to 3 minutes, remove and repeat one more time. Then proceed with your normal, regular dressing change. This isn't just a quick rinse. The contact time is what helps break down that biofilm layer. You're essentially softening and disrupting that bacterial fortress, making your wound more responsive to healing. Now, please note, this is supportive care, not a replacement for medical treatment. If your wound is worsening, painful, or showing signs of infection, please get it assessed. Chronic wounds always benefit from a full care plan, not just one product. If your wound isn't healing, don't just assume it's slow. Start asking why, because biofilm could be the hidden barrier holding everything back. And once you address that, that's when healing can finally move forward. If this video helped you understand your wound better, subscribe for more practical wound care tips and drop any questions you have below. Head to thewoundconsultant.com for expert wound care consultations, practical guides, and educational books, your go-to resource for smarter wound healing.